Thank you for the advice, doctor. A very popular topic that everybody's talking about now, and even myself, I would like to know more about it, is the influenza that's going around in the country, and questions about whether to take Tamiflu or not, depending on the age of the child. So if you can give us some information about that, we'll be very grateful.
Yes, it's a very important question, and many parents are anxious about it. We just thankfully recovered from the COVID pandemic. So continue your hand hygiene, encourage your child to wash hands, not to share objects with friends in school, and so on. Apart from that, of course, the flu vaccine for any child above 6 months of age, and even for adults, it's recommended to take the flu vaccine. It's a seasonal vaccine, so you need to take it anytime in the season. It's a injection. The first time you get it in the first 8 years of age, you need 2 injections, and then after that, it's only 1 injection for that season. The Tamiflu as a treatment of flu, I mean, if you look at the guidelines, there is no real recommendation to even do the flu swab. If the symptoms are typical of flu in the flu season, you assume it's flu. Most of the time, it's symptomatic treatment. It's not a dangerous infection. Tamiflu is only indicated for serious types of flu if the child is hospitalized with flu-related infection. Its efficacy is more if it is started in the first 48 hours. So the severe infection in the first 48 hours tends to be more as well. So it's not the degree of fever. Remember that a high-grade fever is quite common with flu, and you just need symptomatic treatment. If the child has a pneumonia or breathing difficulty because of the flu, it's more significant. If the child has underlying problems which increase the risk of complications like underlying asthma, underlying diabetes, remember that a viral wheeze that the child gets is not asthma. If the child has underlying diabetes, if the child is immunocompromised, then we may have a lower threshold to use Tamiflu. I know there is pressure on families, there is pressure on doctors to use Tamiflu. It's a safe medicine. If your doctor prescribes it, you can take it. It's available in syrup form as well. And in babies, we have a lower threshold because they can worsen quickly. And of course, the RSV virus is also peaking. And if your baby was premature, you can check with your doctor if your baby would qualify for prevention of RSV with an immunoglobulin in the first year, especially if they were very premature or had lung disease. So if your doctor hasn't discussed or they were not aware that your baby was premature, you may need to inform them. This is the season for the RSV infection as well. And this year, particularly both in UAE and in other countries like the US, there has been a big spike in the incidence of both influenza and RSV. So take the precautions to spread, avoid going to crowded places unless it's essential, continue to follow the hand hygiene precautions. If you are going to a crowded place, you can still wear a mask. I mean, many people are not wearing, but there is no harm in protecting yourself.